Now here in Module 7 we're going to address overview of addressing specific challenges, identifying triggers, managing obsessive thoughts, resisting compulsions, dealing with anxiety, maintaining consistency. Consistency is key. Navigating relationships, handling the relapses, and maintaining consistency. So let's bring this over. Right, let's go into this. Addressing specific challenges in managing OCD requires a target approach tailored to individual needs. Here's some ways basically you can tackle these common challenges. Identify the triggers. Recognize the specific triggers that exacerbate your OCD symptoms. Keep a journal to track triggers and note patterns of thoughts or behaviors associated with them. Once you've identified them, work with your therapist to develop the strategies for managing and coping with these triggers effectively. Now, managing obsessive thoughts, practice cognitive restructuring techniques to challenge and reframe the irrational and distorting thoughts associated with OCD. Replace negative thoughts with more rational and balanced perspectives, gradually reducing their intensity and frequency over time. Now, you can't logically get rid of OCD in a sense by just using pure logic, but you can tell yourself these are irrational fears. So you can to a point, because it's an emotional response, but you can tell yourself these are basically irrational. They're not real. Even if you think they're real, they're not real in essence. And whatever you're checking, even if it's something physical and you feel like there's a problem or something like this, don't check it. Don't, even if you have severe doubts about something, even if your leg is hanging off and you've got some severe doubts, I don't mean extreme, but I mean, if it's coming from your OCD, which it will be, just don't check things. Just don't do it, because you're feeding into the cycle. This ties into the resisting of the compulsions. Implementing exposure and response therapy, the ERP techniques, to gradually expose yourself to feared situations and triggers while refraining from engaging in compulsive behaviors. Start with the less challenging ones. We've mentioned this before as well. And gradually work your way up, building the confidence and tolerance along the way. Dealing with anxiety. Now, this is interesting because anxiety, develop and relaxation techniques such as deep breathing, progressive muscle relaxation, or mindfulness meditation to manage anxiety and stress associated with OCD is very powerful. Incorporate these techniques into your daily life routine and promote calmness and well-being. Try and maintain a consistency. Stay consistent with the therapy sessions, medication regime if prescribed, and self-practices to affect managing OCD symptoms. Set a realistic goal and prioritize self-discipline and commitment to your treatment plan, even during challenging times. Navigating relationships. Communicate openly and honestly with loved ones about your experiences with OCD. Educate them about the disorder. Show them articles, videos, whatever. Whatever you think will help them. And how they can support you in your journey to recovery. So seek couples or family therapy if required, if needed, to address relationship challenges related to OCD if it's causing problems there. Now, handling relapses, one of the most important things. Understand the setbacks and relapses are a natural part of the recovery process. Instead of viewing them as failures, use them as learning opportunities to identify triggers and develop more effective coping strategies. Find out to your therapist, so reach out to your therapist for the support and guidance during these difficult times. But it's not black and white, like I say. If you relapse, get back on horse straight away, move forward. It's important. And when you have these OCD thoughts and ruminations in your head, try to just not entertain them. Don't play their game. They're trying to get you to engage mentally or physically. Don't do it. It's a bully. Bullies are cowards. Don't entertain it. Easier said than done, but trust me, if you put this into practice, you'll see some vast changes instantly, and over the days you'll see some massive changes in your OCD condition. Now, building a resilience, you have to cultivate resilience by practicing self-compassion again, acceptance of the situation and positive coping skills. Focus on your strengths and achievements and celebrate your progress no matter how small. Surround yourself with a supportive network of friends, family and peers who uplift and encourage you on your journey.